Hello everyone. In today's video, we are going to be talking about what diabetes is and the different types of diabetes that there are, because sometimes individuals can get confused between the different types, so that's what we're going to get into today. Just as a general overview of what diabetes is a chronic condition that affects the way your body turns food into energy. Your body either can't produce enough insulin or can't use the insulin it does produce correctly. If there isn't enough insulin or cells stop responding to the insulin, too much blood sugar could stay in the bloodstream. Over time, that can cause serious health problems such as heart disease, vision loss, and kidney disease. So, what is insulin? Insulin is a hormone that is made by the pancreas that helps glucose enter cells to be used for energy. And on the right, we have a picture of some insulin bottles that people with diabetes can use instead of the actual insulin cells. There are three main types of diabetes that we are going to be talking about today. The first one we have is type 1 diabetes. Type 1 diabetes is the body attacking and destroying the cells of the pancreas, which create insulin. This results in the pancreas ceasing to make insulin for the body. People diagnosed with type 1 diabetes need to take insulin every single day of their life to survive. It is usually diagnosed in children, teens, and young adults, but it can be diagnosed in people of all ages. Approximately 5 to 10% of the people who have diabetes have type 1 diabetes, so it is pretty rare. And currently, no one knows how to prevent type 1 diabetes. What causes type 1 diabetes? The exact cause is not known, but what is known is that the body attacks itself, especially the cells that create insulin. Genetic and environmental factors, such as viruses, may also play a part. Scientists are working to figure out what specific factors, though. On the left, you see we have a normal cell and vein with glucose and insulin. It's working properly because of the insulin receptors. And then on the right, you see that there is much more glucose in the blood because it is accumulating and is not able to exit the body without the insulin. Symptoms of type 1 diabetes include increase in thirst and urination, stomach pain, vomiting, increase in hunger, nausea, blurred vision, fatigue, and unexplained weight loss. Some risk factors include family history, age, and geography. And according to the U.S. Department of Health and Human Services, in the United States, white individuals are more likely to develop type 1 diabetes than African American or Hispanic/Latino Americans. Next, we have type 2 diabetes. Type 2 diabetes is the most common form. About 90 to 95% of all diabetes cases are type 2, so it is pretty common. This occurs when the body does not use insulin well and cannot keep the blood sugars at normal levels. Too much glucose stays in the blood, making the blood sugar higher than usual. It is usually diagnosed in adults, but can be diagnosed in people of all ages, and this type of diabetes can be prevented. What causes type 2 diabetes? If you have type 2 diabetes, your body has become resistant to insulin, which means your cells do not respond to the insulin your body makes. This causes blood sugar to rise. Having high blood pressure can cause heart disease, kidney disease, and vision loss. The exact cause is unknown, but genetic and environmental factors play a role. Other causes include being overweight or obese and not being physically active. This is one thing that you must remember, though. Not every person who has type 2 diabetes is overweight or obese, but there is a strong link between being obese or overweight and having type 2 diabetes. And on the right here, we have a little diagram, and you see obesity, inheritance, and other factors leading to insulin resistance, which makes the muscle unable to use glucose due to the insulin resistance. Then we have the pancreas and sufficient insulin secreted in the bloodstream, and it's just an endless cycle of not being able to get the proper amount of insulin for the body. Symptoms of type 2 diabetes include increased thirst and urination, increased hunger, feeling tired, blurred vision, numbness or tingling in the feet or hands, sores that do not heal, and unexplained weight loss. And some risk factors include weight, inactivity, family history, race or ethnicity, age, and high blood pressure. The final type of diabetes we are going to be discussing today is gestational diabetes, and this occurs during pregnancy to individuals who have never had diabetes, and it usually goes away after the pregnancy is over. Afterwards, you and the baby/babies are at a higher risk of developing type 2 diabetes later in life. Every year, 2 to 10% of pregnancies in the United States are affected by gestational diabetes. And on the right, we have some little factoids about gestational diabetes. You can pause and read through them, but we are going to move forward now. What causes gestational diabetes? This occurs during pregnancy if the woman's body is not making enough insulin, making her insulin resistant. So her body needs to produce insulin for herself and for the growing child or children in her body. So if it's not able to make enough, it will become insulin resistant. Genetics and being overweight or obese are also linked to gestational diabetes. And again, on the left, we have some more facts. You can read through them. We're going to move forward. Symptoms of gestational diabetes. Gestational diabetes usually does not have any symptoms. If you were to become pregnant, your doctor should test you for it when you are about 24 to 28 weeks along in your pregnancy. Some risk factors include having gestational diabetes during a previous pregnancy if you were pregnant before, age, family history, weight, race, or ethnicity. Complications that are caused by having diabetes. The longer a person has diabetes, the higher the risk is to getting complications. And these complications could include heart disease, nerve, kidney, and eye damage, skin conditions, hearing impairment, Alzheimer's disease, and depression. Testing for diabetes. For type 1 and type 2 diabetes, a blood test can be taken to determine if you have it. For type 1 diabetes, insulin must be taken every day, whether that be an insulin pump, a syringe, or an insulin pen. And there is another medication that some people with type 1 diabetes do take. It is not required, excuse me, but it does help with the intake of insulin. It is called pramlintide. For type 2 diabetes, they may need to take insulin, maybe not, as well as other medications. So not everyone who has type 2 diabetes needs to take medications, but sometimes it can cause other conditions, such as high cholesterol or high blood pressure. So you may need to take medications for those. For gestational diabetes, a blood test can also be taken to determine if you have this or not, as well as a glucose screening and a glucose tolerance test. There are some different types of tests that could be taken to determine if you have either type of diabetes. The first is the A1C test. This measures your average blood sugar levels over the last 2 to 3 months. If it comes out over 6.5%, you are likely to have diabetes. The fasting blood sugar test measures your blood sugar after fasting overnight. Having 126 milligrams per deciliter or higher indicates you are most likely to have diabetes. The next test we have is the glucose tolerance test. This measures your glucose before and after drinking a liquid containing a lot of glucose. After waiting about 2 hours, if your blood sugar is 200 milligrams per deciliter or higher, this indicates you are more likely to have diabetes. A random blood sugar test measures your blood sugar at the time you are tested. So if you go in at this very moment and get a test, that would be your test. If your blood sugar is 200 milligrams per deciliter or higher, indicates you are more likely to have diabetes. Being able to manage diabetes. With the help of your doctor and these steps, diabetes can be managed. When it comes to type 2 diabetes specifically, it is a lot about what you do and the choices that you make to help your body. Type 1 diabetes cannot be prevented. It can be managed in these exact ways as well, But type 2 diabetes can be prevented, so we want to try everything we can to prevent us from getting type 2 diabetes later in life. These steps include making healthy food choices, being physically active, being in control of your blood pressure and cholesterol, being able to recognize the signs of high and low blood pressure, and getting the supplies you need and storing them accordingly. And here are all the references that I used. If you would like to seek out any more information, I would suggest going to these websites. And I really hope you enjoyed my video. Bye.